Dr. Anestis, how are you today?
Doing great. How about yourself?
I'm doing all right. I'm glad that you've decided to give me a little chat here today, and I'm very appreciative of your time. I wanted to talk with you about this latest study that you guys put out at the Gun Violence Research Center, and you care to talk a little bit about it with me?
Yeah, I'm happy to. Appreciate the opportunity.
So it's the 2022 report on firearms in New Jersey, and you guys surveyed approximately 1,000 adults in New Jersey on different aspects of firearms storage and where they keep them and where they may have them, right?
Yeah, exactly.
Okay, so of those the participants, and I see you have it broken up into different areas, suburbs, exurbs, and of course we have like the shore as its own region, and then the greater Philadelphia area and that type of thing as well. Um, were you able to get more or less from these different areas, or was it pretty homogeneous when you put your surveys out?
Yeah, so in this case, we partnered with the Eagleton Center for Public Interest Polling, and what they do statewide omnibus polls all the time. So basically, what they do is they use probability-based sampling, which I don't even fully understand myself, to be honest with you. But it is the method that gets you the most representative sample. So when you try to get 1,000 folks from Jersey using this method, the goal is to get it so that people are sort of distributed in the survey the same way they are around the state in reality. So we don't have a New Jersey survey that's 80% Newark. Um,
Gotcha.
you want it to look like the state. So that's what these guys are particularly good at doing, is really getting you to say within, what is it, I think 3.8 percentage points, we have a pretty good confidence that this is a good estimate of how many people do this or that.
Perfect. Yeah, I was just trying to figure out where that pool came from. So thanks for sharing that information with me. So I kind of have your report, carved up into three parts. But I guess what I want to get at with you is what do you think your most meaningful finding is, based on the study?
I think there are a few things that stand out, John. One of them is that, the percentage of folks in our survey that endorsed living in a home with a firearm was right around 20%. And that's higher than you see in most places. And I think that was for a couple of reasons. We can get into that in a minute if you want. So that one stood out. The other two things that stood out to me that I'm sure we'll get into in a bit, one was actually the age breakdown on who's carrying outside the home most often. And maybe that won't surprise you. I'd be really interested to hear your perspective, but I was surprised by that. And then the last one that I hope we'll touch on is just the percentage of folks who've had sort of any opportunity to discuss firearm access with healthcare providers.
Sure. So we have what do we say here? About one in five New Jerseyans live in a household that have firearms, right?
Yeah.
Okay, so now on your study here, you break this down by demographics, based on race, and then also the geographical location. I thought it was very interesting that the shore locations actually had the highest instance of admitted,
Right.
we'll call it gun ownership or firearms in the home, whereas your refused to answers, which um, interestingly enough, what was it, 4.5% of whites, 8.1% of black, and I can't see the percentage of Hispanics.
It's zero. We had zero
Zero.
on that
Okay,
one.
there's 0%, and then 2.5% of other refuse to answer the question. So,
Mm-hmm.
all right, your Hispanics are like, all right, we're going to answer this question no matter what. With African Americans being probably the most leery, and I think there's I think that's an important finding, especially since a lot of our gun control laws are founded in racist roots. So having a black population being leery to answer that question doesn't shock me. I don't know if you have comment on that at all.
Well, I think that there's a pretty good long history within the black community of being fairly mistreated by scientists and researchers asking about personal issues, and firearm ownership is a pretty personal topic for a lot of folks, and so I wasn't completely surprised that a community that has been, quite frankly, mistreated by folks in positions like mine historically maybe didn't want to talk about it.
Sure, sure. Okay, one of the other things that you've got here is a section on firearm storage in New Jersey homes. And I guess one of the important things to highlight here is that, your questions aren't necessarily revolved around any particular statute, correct?
No, we're just asking what people do.
Right. So, I mean, I guess we'll clear up the air. There is a statute in New Jersey, right? You're aware of it,
Mm-hmm.
on firearm storage. So that statute, 2C 58-15, and not to diminish it, I'm not going to read the whole thing, but basically is, you got to keep your firearms where children can't access them, right?
Right.
Okay, perfect. What did you think was most meaningful about the results on firearm storage in New Jersey homes?
So I think a couple things stand out to me. One, it's largely positive, to be honest with you. So if I look at these results compared to just about any other sample I've collected outside of Jersey, or at least not specifically just Jersey, folks are storing their firearms more securely generally. And to be clear, John, like one of the tricks in doing this work is, let's say someone owns 10 firearms, they own 4 rifles, and they own 6 handguns. I'm not able to know which of these storage practices they use on each firearm and how often and what circumstances, right? Like, this is a really basic, hey, do you do this with at least some of your firearms kind of question. So keep that in mind, that we're not getting like a really clear picture. And part of that's because people don't want, first of all, it's a lot to ask people all those questions because it's going to annoy them to answer 8,000 questions. But also there's only so much information people really want to share about sort of how they're staging their firearms in their home. So keep that in mind. But all that being said, people store their firearms pretty securely in Jersey relative to what happens in other states. So from a suicide prevention perspective, yeah, I was actually pretty pleased with this. The thing I'm keeping my eye on is there's very few people are storing their firearms in their vehicle with any great frequency, but I keep an eye on that one, that there are some folks who are doing that very frequently. And now maybe they're doing it in a really safe method. Maybe there are sort of factors that make that less concerning, but just sort of keeping an eye on that, because I've read a decent amount about new firearm owners, less experienced firearm owners, storing their firearms in their vehicles, and those firearms being stolen and then trafficked, right? So that caught my eye as a little bit less thrilling than some of the other stuff.
Well, sure. And to be fair, your survey was done in July, right?
Yes, I don't know the
Yep.
exact dates off the top of my
July.
head, but I want to say it was like
Yeah.
a week in mid-July.
Okay, so it's mid-July, and something that happened in June that didn't necessarily trickle down to July. And I feel, if you ask these survey questions again next year, you're going to have potentially very different results.
Oh, absolutely.
In the wake of New York State Rifle Pistol Association versus Bruin, um, the legality of keeping your firearm in your car is going to change. Whereas, for the most part in New Jersey, without a concealed carry or a permit to carry, I should say, it's illegal for you to keep a firearm in your car. So, I found it kind of interesting that you were able to get those kinds of answers to these questions, because I'm sure the people that you surveyed, I mean, you didn't ask how many of them are permit to carry holders, did you?
No, by design we didn't. We didn't ask that.
Right.
We really didn't want people to feel. And there's a good amount of anonymity. And as a clinical psychologist, I've asked people about all sorts of things that aren't legal. If you can get people comfortable and assure anonymity, which we can in these situations, we're not reporting these data. No one has access to anybody individual. We don't even know. I don't even know the identity of any of these folks. I couldn't personally find out. So you create an environment they're willing to. But if anything, these are probably underreported numbers for the exact reason you're pointing out, right? Like, if you're not supposed to be doing something, you're more likely to tell me you're not or to refuse to answer the question than you are to admit doing it.
Right, exactly. So, I mean, that all aside, none of these numbers are really affected by any of the changes in policy in New Jersey post New York State Rifle Pistol Association, because the first permits to carry post that case, weren't really issued until I'd say maybe August. I mean,
Yeah.
so it's taken some time. And you and I talked about this last year, and not to put words in your mouth, but you voiced your reluctance to embracing this, whereas obviously I'm looking at this as a net positive, and we could agree to disagree on that. But the numbers aren't going to be affected by that.
Well, yeah, not in this report. And I also do wonder if some of what we capture in the vehicle storage in a summer month might be some a little bit more casual insecurity of storage hunters who just, during hunting season maybe keep their, weapons in their car. And then in the wintertime, they lock them up too. Like I would love to not only do this survey annually, but to vary the month in which I do it. To sort of capture some of the seasonal patterns that also, in addition to things like Bruin, also can impact how people are sort of managing their firearms at any given moment.
Sure, sure. Yeah, and I was kind of shocked at that number though. Me too. And here's the thing. My perspective on this thing is your car is not your holster, your car is not your gun vault. But in a post New York State Rifle Pistol Association world, we will be storing our firearms more and more in our vehicles, hopefully in lock boxes or console vaults or whatever people have. And that's mostly because the state of New Jersey is planning on changing our laws. So where people will and won't be able to carry their firearm, you're going to have more people having to disarm before they go to certain locations. And that's, creating, in my opinion, the more opportunities to handle a firearm is not necessarily a good thing. So um, any change of law in those regards, I think, is actually going to create an unsafe situation with people disarming and arming in parking lots. But that's just a matter of opinion.
It's certainly something worth tracking and keeping an eye on. I think a lot of times things aren't as simple in terms of good or bad as they're intended to be. I think there's an overarching goal, and then there are a lot of sort of downstream effects that are always worth tracking and keeping an eye on. And it's a very reasonable point you raise, and something that I actually would want to give some thought into figuring out is there a way. It's going to be a difficult thing to measure, thing to assess, right? You can ask someone after the fact, hey, is this a thing you've done very often? And how reliable is that? I don't know. But it would be worth tracking to see to what extent that exact situation pops up as people sort of adjust to can I or can I not carry in this particular location.
Oh yeah, and this is going into the weeds, but I'll bring it up. There's a couple of cases out there, and there's one county and then one case in another county where I know permits are being restricted where people aren't able to keep their firearms on their person loaded in their vehicles. So when they get to their destination, they're supposed to get out of their car, open the trunk of their vehicle, load their gun, and then arm themselves concealed. Well, in the parking lot of a Kroger's or Target, that poses all kinds of other issues, regardless of whether or not people want this to happen. That's forcing these people to do such a thing, and it's one of those unintended consequences, I feel.
Yeah, well, yeah. I mean, we could go back and forth on maybe going into Kroger isn't a place where you should load up and carry. There's a lot of I think there's a whole lot of different perspectives on this, and I think the thing that we're definitely going to agree on the most is we better track what's happening. The effect of anything, whether you're in favor of it or not, you need reliable data to let you understand the realities of what's happening, and reliable data that's not easy to spin to fit the agenda of one person or another, but just data that lets you objectively look and say, well, what is and is not happening, and to what extent then does that impact sort of the public good, right? And that's going to be tricky data to get, but that's worthy data to pursue.
Sure. Um, I guess while we're still on storage, before we leave this area, because I don't know if this is leading or it's not leading. So we already went over New Jersey storage law, and firearms in a locked location, a gun safe, firearms that are stored with a cable lock, um, firearms with or without reach of ammunition, all of these storage methods may or may not be statutorily protected, depending on an individual's, you know, living arrangement, correct?
Can you give me more on what you mean by that?
Well, so if our statute says we're supposed to keep firearms not within access of children, by virtue of that definition, somebody that doesn't have children in their home doesn't have any statutory way
Correct.
to store their firearm. So I'm just saying that just because somebody stores their firearm in a nightstand, which is not something I personally recommend or teach, but if that's what somebody wants to do, and if they live, alone, that's not necessarily breaking the law. I mean, I'm not giving you,
No,
yeah,
yeah, yeah, and that's not, and that's certainly not what we're trying to indicate people are doing. But I work with firearm owners, not at firearm owners, and so this isn't a value judgment, or it's certainly not a claim of illegality. It's simply, from the scientific perspective, noting that some storage methods appear to bestow greater risk for certain outcomes, and people might say that's an acceptable risk to me compared to this other risk. And that's a personal decision they make. We're simply trying to, at this stage of the game, characterize what folks are or are not doing.
right. And I mean, look, from what I'm seeing here is we do have, at least of the surveyed people, and we're willing to answer, people storing their firearms in a very reasonable manner, and whether it's a gun safe or a locked box. And one place where I'm sure we might diverge is, an opinion is storage of firearms locked in a separate location, unloaded from ammunition, is good in certain instances, but in my opinion, it's not all instances.
Yeah, well, so I think so. Let me speak from the suicide prevention perspective on this, which isn't all perspectives. It doesn't cover everything. Um, when I'm doing, for instance, lethal means counseling with someone, and I'm talking about, how do you store your firearms and what would you consider in different circumstances, the idea is that in a moment of suicidal crisis, either the firearm owner, him or herself, or anyone else who could access those firearms, having quick and ready access to a firearm, the quicker you can access it, it's just greater odds the individual's going to use it and die. And the data on that are pretty tough to argue against. But then the issue is, if someone owns that same firearm for personal protection, the counter argument is, well, what if somebody breaks in the middle of the night, and I don't want to have to fiddle with a lock, or I don't have to then load the firearm after I get it out of the lock when that person's already coming in armed and ready to go, right? And so this is the scenario, or the set of scenarios people are balancing out. And what I find often is that folks' concern about someone breaking in is higher than their concern about suicide, death, or unintentional shooting, or the other sort of things that I obviously tend to focus on more, right? And that's a personal decision for sure, to the extent that we can acknowledge the data on some of these things. But that's sort of where it's at. So my point is it always, is it a destiny for someone who stores their firearm loaded on their bedside table that something bad's going to happen? No, of course not, right? And most firearm owners aren't suicidal and never will be. The issue that comes up from my side of things is that people often don't know about risk until it's there. And the most common story is, I didn't see this coming. And so all I'm trying to encourage on the sort of secure storage side of things is to plan, so that when things are getting a little bit more stressful, maybe you stage your firearm differently than when you're feeling great. The same way, honestly, look, if someone has their grandkids coming over, they probably think about their firearms differently for the hour the kids are over than the hour when the kids aren't there. It's adjusting to the moment that you're in, and the level of risk you have, and how that risk compares to the other risks that you're balancing out, that prompted you to have that firearm in the first place.
Right, and that's like something that a group called, Walk the Talk America. I know you're familiar with them
Mm-hmm.
and their work. They have the cause the pause, right?
Yeah.
And some people might think it's silly or whatever, but advocating for gun owners to put a photograph or something, a reminder of what's important to them on their gun storage device, on their safe, to make them stop and think. Because if you can interrupt that action, we know that there's a greater possibility for survival. So I get that. Um, and one of the challenges that you and I discussed last year was that in states like New Jersey, if Bob was having a problem and he's not feeling really his best, he can't go over to Bill and say, "Bill, can you hold my guns for me?" There's nothing in New Jersey's law that allows that, and I think that's a failure of our legislators in a big, big way because that's a very easy way where you can cause that pause, especially if somebody's going to sit there and concede that okay, maybe the threat of a home invasion or whatever isn't going to be as prevalent on their mind. Where they says, "Listen, maybe it's best for me to get these firearms out of my hands." You know?
Mhm. Yeah, and this is a point where you and I agree a lot, actually. And I think the person I hear who talks about this most compellingly is a friend of mine, Emmy Betts, who's an emergency physician, also works with Walk the Talk America and Hold My Guns on a number of occasions. And she often talks about when you're talking about stuff like storing a firearm outside of the home, you have to make it easy, right? Like anytime you want somebody to adopt something they haven't normally done, if you make it a pain in the ass, they're just not going to do it, right? And it's a little bit of a pain in the ass here. And I understand I spend a lot of time trying to look at multiple perspectives. So when I put on the hat of the legislature, I understand you want to avoid unfettered transfers of firearms and sort of anarchy on that front. Okay, from the suicide perspective, I want someone who is having a hard time and open to temporarily removing access on their own terms with someone they trust to do that in a way that balancing out is going to decrease the odds of a fatality because the highest risk for fatality is that person's suicide in that moment. Right. So I'm very much in favor of carving out exceptions for imminent suicide risk. Is that complicated? Sure. There's sort of like, well, how do we know when someone can get the firearm back? Yeah, absolutely. But I would absolutely err on the side of making it more plausible for someone who wants to create more space for themselves for a moment, but do it in a way they're comfortable with to do so.
Sure, sure. Well, there was another portion of the study, that you touched on, the outside the home and who's carrying a firearm portion here. Is kind of meaningful. I'm not trying to discredit it, but most of that is probably illicit. So, I doubt the surveyors were able to hit the 500 concealed carry permit holders and that were in the state prior to
Oh yeah.
so who's carrying a firearm outside the home? That number is going to change dramatically based on the legality of it here within a year, I'd say. But the other portion of the study that you brought up was the physicians, and you had said something to me off air about this. So let's talk about that. And you thought this was really meaningful.
Yeah. So and there's probably a good bit to say about this. So what stands out immediately if you look at it is that less than 1 in 10 New Jerseyans have ever been asked by a healthcare professional whether they have firearm access, and a lot of folks might hear that and be like, "Well, yes, none of their business." Totally get that, and we can circle back to the sort of trust side of things and maybe who would be a better messenger in a second. But the reason we asked is if we're going to try to encourage things like secure storage in times of stress, we need to have sort of opportunities to do that, right? And when the folks who are most vulnerable to dying by suicide using a firearm are less likely to engage with mental health care, they're less likely to tell people that have suicidal thoughts, they're less likely to attempt it before. So our system that's typically designed to sort of talk to people about it's not a good fit, right? So in my head, I'm always thinking about, well, who are the folks who do see people and talk to them about sensitive issues? So where are there opportunities where maybe if it's done right, you can have a conversation that isn't about someone's rights, that isn't about trying to take something from someone, but helping someone plan just to be safe in a different way than they normally are. And so physicians or medical professionals pop out as an example of that. And it's just very rare here in New Jersey. And I got to tell you, actually, Jersey is the only place that's ever happened to me. I took my son for his first wellness visit. We moved up here from Mississippi, and the pediatrician asked, and I totally weirded him out because I freaked out. I was like, "Thanks for asking," which was not the right thing to do. It was ridiculous, but that's the only time it's ever happened for me. So it's not something that I expected to have a lot of people say yes to, but I thought the number was going to be higher than it was, to be honest with you.
Based on the state. And you brought up Dr. Emmy Betts, and she had participated in a study earlier this year in, I think it was Washington State, and it was self-reporting and who were and were not, firearm owners prior to and after any possible suicidal ideations. I don't remember the exact paper, but one of the findings that was in the paper, and I know she wasn't pleased with what I had said. I mean, I can't put those words in her mouth. I don't think she was pleased. I think they said something like 40% of the people that died by suicide by firearm did not report that they had firearms. And in a state like Washington, and I believe that was the state, these aren't people that are going to go out and buy a firearm. These are people that probably lied about their previous firearm ownership or access. Um, and there's that chasm between physicians and patients. And personally, and we talked about this, the trust issues that are there. Um, I understand it, and there's physicians that I discussed the issue with where they would flat out say that it's a boundary violation. Would the insurance carrier of the physician be okay with the doctor talking about something outside of their scope? And maybe you could answer some of this to me. In med school, is there an area where physicians are really being taught about firearms, where they can talk about them in in an educated manner besides a prohibitionist way?
So, I can't speak to the specific curriculum, but I can tell you my general sense when speaking to physicians is no, that most folks are not educated, don't feel comfortable doing it, are afraid they're going to alienate their patients, and are probably right because they probably do it clumsily because no one's training them on how to do it in a way that's appropriate and informed. And that's a problem, right? And so I think there's a couple of issues. One is you can ask, well, is it appropriate for medical professionals to ask about this? I think it probably is if it's not done from a prohibitionist standpoint. So if it's not done from a values based, you shouldn't own this, but hey, let's just look at your home environment. And if this is here, firearms undisputably come with some risk. And we just talk about how you're managing that risk and not prescribe what you have to or have not to do. But can we understand that? That doesn't feel inappropriate to me, but there's plenty of room for people to wildly disagree with that. And that's fine. But the second question is, man, shouldn't we be equipping people with the tools to do this effectively? Which is a lot of what my team is doing. We're working with all across the DoD to help folks do this. We're hoping to work with faith leaders on how to do this. I'd love to work with bartenders, John, on how to do this. Just people who talk to people, especially people who are trusted. Not to, again, tell people what to do, not to make some registry of who's doing what, but just to normalize having conversations about, hey, sometimes risk is different, and in those moments, what might I do that I'm comfortable with that lets me feel like myself and my family are safe, not only from the things I generally fear, but also from what's going on in this moment. That's it.
Yeah, no, I get it completely. And um, of course, my view is a little bit different. And when you're looking at numbers, right, if this is a numbers thing, there are physicians that I've spoken to that, have been quoted to say, 400,000 to 1.5 million deaths a year are attributed to mistakes that doctors make. So maybe some of those doctors should stay in their lane, especially when the number of firearms deaths are grossly eclipsed by those numbers.
Well, I mean, fair enough, but how many? Yeah, well, I don't think we're going to get into a huge. It's not worth getting a huge. I think that
Sure.
I don't know what those numbers are about medical error deaths, and again, reliable data. Something you and I have talked about throughout this call. I think it's really important that we're making characterizations that accurately reflect the data. But I think it's probably pretty indisputable that of all the people in society best equipped to address medical concerns and disease is probably medical professionals, right? Like, you don't want to end up in the room with me, the clinical psychologist, when you're bleeding. I can ask you how you feel about it, but that's not going to be very useful, right? So I think that there are plenty of things that are done very well. The question is, does a discussion about environmental safety in the home fit in the context of the role of the medical professional? I think it probably does, but it depends on how skillfully they do it, right? And undoubtedly, there are people who will do it unskillfully or do it very politically. And that's unfortunate. And I think it sets us all back. I tell people all the time, the very best thing I ever did professionally was to live outside of my bubble for a long time and see bubbles for what they are. And I think a lot of people haven't done that, right? And a lot of people are trained to believe that they are experts on things that they are not experts on. And that's a problem. That sucks, right? But if we can get past all of those general sort of disappointments of humanity that apply well beyond medical professionals and just apply some skill, like folks like myself, what we could do is train these people to be better and make use of it. But also, it may be at the end of the day, medical professionals aren't the best resource for that. And that's a totally valid perspective and one I'm open to. But someone's got to have that role. Someone's got to be filling the void to make this conversation be something that normalizes thinking about these things. And it's possible, and you and I talked off air about this, that there are other people. And what our research is finding is that a particularly valuable voice on this, and we've got this from surveys, and now as of today, just published in experimental data, law enforcement stands out, both civilian sort of law enforcement, but also in this most recent study, security forces, so essentially military law enforcement, being just much more compelling voices on this. And so it might just be that we have to think differently about, if you want to get traction on a conversation about safety that isn't about rights and isn't about the Second Amendment, it's just thinking about safety, it has to go through the right channel. Maybe that isn't the right channel. I don't know. It's worth asking.
Yeah, and I'm really, really glad that you brought that up because I think that's important. And again, my opinion is let's stick to the medicine with the doctors. And, we don't have doctors really weighing in a lot about swimming pool safety and, shock hazards. I don't know.
Well, pediatricians do, or they should.
Yeah.
or we could disagree that they should do any of that, in which case there's that.
Right. So, when it comes, again, to the firearm thing, we both agree that it tends to get polarized where it shouldn't. And if we could, quote unquote, stick to the facts, I think would be that much more better,
Yeah. And I will say some of the tool, like one sort of middle ground on this, and we keep coming back to Emmy Betts, and I probably should have asked her if I'd be talking about her on this call so much, but she does have a tool called Lock to Live that might be a middle ground on this, where it isn't the medical professional doing all the talking. They can just direct them to an online tool that folks do privately on their own phone. Right. And so maybe, because what I'm looking at isn't that I think medical professionals are the firearm experts. Of course they're not. I mean, maybe they're firearm owners, they are, right? But they're not, by virtue of being a doctor, a medical professional, it doesn't make you a firearm expert, obviously. Like, we can all agree on that. So the idea isn't that I want medical professionals asking about this because they are the most knowledgeable and well-equipped to do this. It's just that I want a place where everybody goes and where they talk about stuff. I want this to come up somewhere, right?
Right.
But they don't have to do the talking, right? So maybe they're facilitators of directing people to a better voice, whether that's an online autonomous tool like Lock to Live, or maybe that's materials from law enforcement, or maybe maybe it's multiple groups working together, right? But the idea isn't that there's something magical about medical professionals at all. It's just that I want this conversation to happen, and so testing the waters on where it is and isn't happening, and where there's an infrastructure in place where people are already going through, and we're not relying on being like, well, I'll ask the people I know are suicidal, because that's the absolute worst strategy you could possibly have on doing this. So it's just, how can I make this conversation happen in an unobtrusive, apolitical way that touches enough people that it's normalized, that people don't feel like something invasive is happening, and where they still maintain control. They're not being told what they have to do, but they give some thought to it in a different way than people usually think about it, I think.
Sure. Well, Dr. Anestis, I really appreciate your time. I just got two other real quick things here.
Yeah.
You and I talked a lot about suicide prevention, basically accident prevention. This is kind of maybe, and this is going to probably parlay into my next question. The group, it's called the Rutgers, New Jersey Gun Violence Research Center. And pretty much you and I have, talked mostly about, preventing suicide. Is there maybe room in there that the name of the research center should be changed, or that be parroted a different way? Because gun owners see this and they have a problem with it.
So, I don't think so, for a couple of reasons. The biggest reason is that we're talking about suicide prevention because you're talking to the suicide prevention guy, right? That's what I do. I was a suicide prevention guy long before I was doing any research related to firearms. But if you were talking to Dan Semenza, who's in our the center as well, you'd probably be talking primarily about homicide, which is where his research focus is, right? So I think the conversation goes where people are more, I stay in my lane, basically,
Sure.
right? That's where my expertise is, and so that's where the conversation went. So I don't think that our conversation reflects. If you look at the actual list of projects we do or the research interests of all the folks we're training, most folks are actually interested in homicide. I'm sort of the dude who stands out. Me and a couple of my students have been particularly focused on suicide. So I don't think that is the case. But you raise a second point, John, about people looking at the name and being put off by that. And I guess I think it's a situation where, look, I know a term gets politicized. There's only so many times you can change the name, quite frankly. Like, bureaucracy. I know bureaucracy. Changing names sucks. And so dealing with that and rebranding is that's real tough. And I guess my hope is that, folks don't get too hung up on a name and can talk to me and talk to our people and look at our work and have conversations. The things they fear aren't us. There are plenty of people with gun violence prevention in their name that are going to approach this in a way that would be more confrontation with you, just like there are people who would put gun rights in their name and be more confrontational with me than you are, right? So I think that there are extremists all over the place. That's not us. So I guess it's sort of a book by cover situation that I hope people can take a step back on.
No, absolutely. And I guess that's the final portion here is, what is your message to New Jersey gun owners? What would you say to them about the work that you do, the work that your colleagues do, and everything over there? Because, and I'm going to say rightfully so, there's some apprehension when you have a state-funded group that's funded by an administration that hasn't really been very friendly to the people they're affecting.
Well, I guess what I would say is it's always best to sort of judge people based on your interactions with them and what they do. And I know that's kind of a vague thing, but yeah, I was a real I was a real fish out of water for most of my career, and so I've spent most of my time working exclusively with gun owners, and I've come to really enjoy it. And I know a lot of other folks like me who do the same. And my center's mantra is we talk to everyone, and we aren't a political entity, and we're not here to alienate anyone, and that you're certainly not going to solve gun violence without gun owners. And so that is a mantra that I'm inflexible on, and nobody's been resistant to. We've got room to talk to everybody. We're open to everyone's perspectives. Our primary and sole goal is to lower the number of people who are injured and hurt. And from a suicide prevention perspective, that's more than half the suicide deaths, right? So the firearms are a big part of the conversation, not because we hate firearms, not because we're trying to, overturn the Second Amendment or impact anybody's rights, just because we want people to be safe. That's it. And so I would encourage folks, if they want to see things done differently, to engage with us. And maybe they won't want to, and that's okay. Or maybe they'll think I'm a prick, and that's fine too. But maybe there's room for us to have a really productive conversation and work together, because I would much rather gun owners' voices be reflected accurately in the work we do than for gun owners to feel like we're talking about them without them.
Sure. So is there a conduit that gun owners could reach out to your center, or is that something that's welcomed, or are there
Yeah.
projects that people should be looking at where their voices could be heard?
Yeah, so I think the best way is always with any academic is by email. Because you never know where someone's going to be. We always check our email compulsively. So you can email the GVRC, the Gun Violence Research Center, and I should know that email address off the top of my head. It's pretty stupid that I don't, John, but I don't. But if you go to our website, you can find it really quickly. We're not going to make money off you going to our website. So this is not me trying to move people around the internet. That's the only place anywhere to find the email. Or you can look up my email address, or it's mda141 at sph.rutgers.edu. I'm happy to email folks. I just ask that you respect that I get way more emails than I can respond to quickly. So if I don't respond quickly, it's not because I don't want to talk to you. It's because I'm spacey and overloaded with email, but happy to engage.
Yeah, I know it took us about 3 weeks to put this on the calendar, so
I know, and I
that.
apologize for that,
No,
but I'm
it's
glad we
okay.
did.
That email address, I'm looking at it right now. It's njgvrc at sph.rutgers.edu.
Yep, and those emails generally they get routed to GVRC staff, who then route them to to myself or Dr. Semenza or Thurman Barnes, the assistant director, depending on the content, and they get to us one way or the other. So yeah, that's if you email that email address, you're not being like shoveled away to someone else to speak to. It's just a central location for emails to land.
Okay, that sounds good. Well, Dr. Anestis, I really appreciate your time. If you've got anything else to add, now would be a good time. Otherwise, I think we could wrap up.
No, I don't think anything jumps out at me. I just appreciate the conversation.
No, and I appreciate your time, and I know there's a chasm on areas of where we definitely disagree, but there's a lot that we do agree on, and I hope that more and more conversations like this will help build bridges to solving problems rather than restricting rights. And obviously, that's where my interest lies. And show that there is a way that people can have a conversation.
Yeah, you don't have to agree on everything, agree on anything, is the bottom line.
Absolutely. All right, doctor. Thank you very much, and have a good day.